this is Stephanie with Healthcare-Edu. I am going to demonstrate catheter care. We are here in Massachusetts, and catheter care is one of the 4 skills that you'll get first. Bedpan, perineal care, catheter care, and emptying a drainage bag. You can get one of those 4 as your first skill on the state exam. So all skills start the same way: hand hygiene with Purell. Gathered my supplies. My supplies are already here, and you'll be able to write it down. Knock, knock, knock into the room. Close the privacy curtain. Hi, my name is Stephanie. I'm your nursing assistant for today. I am here to help clean your catheter. Can I see your ID? And so now I am going to put my items on my bedside table. I'm gonna make a clean surface here. So a lot of state exams, they clean it with Lysol wipes, or you just lay down these paper towels. I teach my students to lay down paper towels. All right, cover the table. Seem to have a lot here. And now take out your supplies. So the supplies are a hand towel. I have 2 washcloths, a disposable mattress pad, and soap. A basin. I'm gonna go get some water. I'm out, I've gotten some water. I'm gonna come back in. Of course, this is educational purposes. I didn't really get water, but when you do it for the state exam in real life, you'll really get water. So when I come back with the water, I will put my hand in the water, make sure it's not too hot, and ask the patient to check with their elbow. How does that water feel? All right, perfect. So set it down. Now, there's 3 things you protect in healthcare: your back, your patients, your back, and your license, okay? So raise the bed to your waist, to your height here. This patient's lying flat. They don't have to be lying flat. You really probably don't even have to adjust the head of the bed. So I've raised my bed here. And so here at Healthcare-Edu, we teach that you do all objects first, then gloves on, and touch the patient. So I'm gonna put my gloves on. I have other videos where I show you how to put your gloves on. So I didn't want to waste one here. So I put my gloves on, and now I'm gonna tell the patient what I'm gonna do. I'm just going to open up just a little bit. We need to clean your catheter. I spread the legs by the ankle, and now I'm gonna fan fold your gown up. All right, there's no need to undress the patient naked because you're only dealing with the lower half of the body. Now I'm going to take a disposable mattress pad. This is a permanent mattress pad. This is a disposable mattress pad. I'm going to tuck it underneath here. Okay, and so that is so nothing gets wet, because if the permanent mattress pad were to get wet, it would stay wet under the patient's skin, which would cause skin breakdown. So now what I'm going to do, I have a washcloth. This is water and soap. So this is my soapy washcloth. And there's a balloon in this. I'll show you after. So I'm gonna put my hand up against the vagina, hold this here. It's bold, you don't want this catheter to pull. I'm gonna go down the length of the catheter, and the steps say to go down 3 to 4 inches down the length of the drainage tube. Then flip the washcloth, so turn it around, go down again. Down the length of the catheter, then 3 to 4 inches down the drainage tube. You roll away from you, put in the hamper. And so now I'm going to rinse, just water only. This is the rinse. Again, my hand up against the vagina, holding this, pinching this tube, go down the length of the catheter, go down the drainage tube, flip the washcloth, down the length of the catheter, go down the drainage tube, in the hamper, and now I'm going to pat dry. You could pat dry the area, you could just hold again. So the bold steps, remember DNS, you need to get an 80% and also meet all of the bold steps. So the bold steps for catheter care are to hold this like I did and make sure it doesn't tug and pull. So now this is the disposable mattress pad. It will go in the trash. So even though I'm putting it in the hamper, it will go in the trash in real life because we're gonna reuse that. Now I'm gonna close your legs here. You're all set. All right, and so the catheter goes on the outside here of the thigh. You could have a leg securer, but make sure it's not occluded, so make sure it's not underneath the patient's leg or anything. I'm going to, of course, pull the gown down so I don't leave the patient exposed. I'm now going to take off my gloves and go into finishing up steps. Finishing up steps are patient comfort. Are you comfortable? All right, side rails up if I had them. Patient comfort, side rails up. Bed low and locked. So I'm gonna lower the bed, make sure it's at its lowest position. Make sure it's locked and it's locked. So bring it all the way down. Don't stop until the bed is at its lowest position. All right, call light within reach. Here's your call light. Call me if you need me, okay? And so now I'm going to take all of this. Again, you may say, your gloves are off, you're touching this table, but there's nothing dirty on this table, okay? Because it's a clean surface. So I'm gonna take all of these paper towels you wouldn't reuse. They would go in the trash. You'd come out to your basin, dump that, rinse it, put it away. And don't forget, this is one of the 4, so it's a soap and water hand wash at the end, not Purell, a soap and water hand wash, all right? Good luck.